In, guys.
Hello.
All right, I think we're good to go, Janice.
Well, good afternoon, everybody. I'm Janice Tyler. I'm director of the Orange County Department on Aging, co-lead here with my friend Daryl.
Yes, and I'm Daryl Davis Fulmer, and I am co-leading with Janice Tyler, and I serve as the community liaison for the Retired Government Employees Association of North Carolina.
So welcome to our All Ages, All Stages North Carolina quarterly webinar. This is a space for us to connect, learn, and take action. These sessions are designed to keep momentum going as we move from planning to implementation. This is the first of 4 webinars with the 4 goals of the plan, and it will give you an inside look at the progress being made, the partnerships that are being built, and the real world impact that we're aiming for together. Here's what you can expect from today's session. Understand what All Ages, All Stages is really about. This is more than a plan. It's a statewide movement to create a North Carolina where everyone at every age can thrive. Learn how implementation subgroups are leading the charge. You will hear how these focused implementation subgroups are shaping key recommendations and driving forward concrete strategies. Gain national perspective. We're going to hear what's happening across the country to strengthen communities for a lifetime and how North Carolina is leading the way. And we're going to find your role in the work ahead. Whether you are a state leader, a local partner, advocate, or service provider, you will leave today with clear ways to get involved, stay engaged, and help shape what comes next. We're just so excited that you're here with us today. Your voice, your leadership, and your partnership are essential to making this plan real in North Carolina. So what is All Stages, All Ages, All Stages, North Carolina? It's North Carolina's multi-sector plan for aging, a coordinated, state-led roadmap designed to prepare our state to support everyone as they age. This plan was developed by bringing together partners from across sectors: health, housing, transportation, social services, and more in a strategic planning process. The goal is to transform our systems, strengthen infrastructure, and improve coordination of services for our rapidly aging population and people with disabilities. This is not a plan to sit on a shelf. It's a practical, action-oriented framework that helps us work more efficiently by we're elevating shared goals, reducing duplication, streamlining efforts so that we can build an inclusive, effective, and responsive future for North Carolina. All Ages, All Stages North Carolina focuses on aligning existing work and doing it better together. You may recognize some of these messages and slides as we share in the introduction. That is intentional. Meaningful change requires time, repetition, and shared understanding. This effort is a significant shift. We are not just launching a new program, but rethinking how we support people as they age, how systems coordinate, and how communities serve everyone. While some ideas may be familiar, each time we revisit them, we hope that they resonate more deeply with you. Because successful implementation means not only knowing the plan, but living it, shaping it, and advancing with all of us here together.
From 2022 to 2025, North Carolina has taken significant deliberate steps to develop and implement its multi-sector aging plan. In 2022, the North Carolina Department of Health and Human Services joined a national collaborative focused on multi-sector aging plans. And this allowed the state to learn best practices and frameworks from other leaders in aging policy. At the same time, AARP North Carolina partnered with the North Carolina DHHS to pursue the age-friendly state designation. And together they launched the Age My Way North Carolina initiative to foster age-friendly communities and promote policies that support aging with dignity and independence. And some of you may have heard some of this before, but it doesn't hurt for us to go a little bit into the history. So in 2023, after conducting comprehensive needs assessments that identified critical gaps and priorities, former Governor Roy Cooper issued the Executive Order 280. This executive order charged North Carolina DHHS with leading the development of a multi-sector aging plan in coordination with cabinet-level agencies across the state government. And beyond the planning mandate, Executive Order 280 included several directives to improve protections for vulnerable adults, enhance nutrition services, expand broadband access to address digital equity, and provide increased support for caregivers, all important issues. And also in 2023, the All Ages, All Stages North Carolina planning process formally began. And Janice and I were part of that. This phase involved extensive engagement with stakeholders across sectors, including health, housing, transportation, social services, advocacy groups, and people with lived experiences. So public input was actively solicited through forums, surveys, and meetings, resulting in over 160 recommendations for addressing the needs of older adults and people with disabilities. By 2024, the initiative launched a targeted media and outreach campaign to raise public and stakeholder awareness of the plan and its goals. Simultaneously, the project team led a rigorous prioritization process to refine the recommendations. And this resulted from the 160, 41 actionable steps grouped into 8 priority areas designed to focus resources and efforts on the most impactful strategies. The final plan was officially completed and published in September 2024. The focus has now shifted from planning to implementation as the state and its partners began to execute the plan's priorities, monitor progress, and adjust as needed to improve outcomes for all North Carolinians as they age. Next slide. Strengthening communities for a lifetime is one of the 4 focus areas of North Carolina's multi-sector plan for aging, along with supporting older adults and their families, optimizing health and well-being, and affording aging, as you can see on this slide here. It is rooted in the belief that age-friendly communities benefit everyone from children to older adults. And that is important to remember. The focus area priorities are affordable and accessible transportation, diverse housing options, digital inclusion, safe public spaces, and adult protections. But there are 3 priorities, as listed on the slide. It also elevates the role of local government, nonprofits, and community members as essential partners in building the infrastructure needed for people to age well wherever they live. As we move from planning to action, we are navigating both long-standing challenges and new opportunities. Across North Carolina, communities face serious gaps in accessible transportation, broadband connectivity, and age-friendly housing. And the rural areas are especially impacted. We also know that older adults are more vulnerable during extreme weather, and natural disasters, but there is momentum. We see strong local leadership and cross-sector energy. The role of counties, municipalities, area aging, area agencies on aging and health systems is critical here, and so is coordination. So building infrastructure and services, especially within communities, to meet the needs of older adults, to help them live safely and independently. So there are key areas that we need to include. I think that may be on the next slide, Divya. Maybe the next one, I'm not sure. I thought there were key slides. Yeah. Okay, so the key areas are adult protective services, disaster preparedness and emergency management, transportation and services options, housing challenges and solutions, nutrition program and access, and then social connectivity and digital literacy initiatives. Right. Janice, you're on mute.
Sorry.
Yes, okay.
So, guys, this work cannot be siloed. Strengthening communities to support people throughout their lives requires a collective impact approach. That means building a shared vision that recognizes aging as a responsibility for the entire community, not just one agency or sector. To achieve this, we must align efforts across multiple areas such as transportation, housing, broadband access, and adult protective services. Each of these sectors influence the others. For example, housing policy must be connected to transportation planning and emergency preparedness to truly create supportive environments for our older adults. Additionally, it is essential to elevate local leadership and center the voices of those with lived experience, including older adults, caregivers, and community organizations. Their participation ensures that solutions are co-designed, practical, and sustainable over time. This approach also means intentionally linking and coordinating with other existing plans and initiatives, whether related to health equity, disaster resilience, digital inclusion, or caregiving support. Integrating these efforts helps avoid duplication, leverages resources, and strengthens the overall system that serves as people as they age. Our goal extends beyond creating better programs. We are working to build stronger, interconnected systems that can adapt, respond, and support everyone in our communities at every age of their life. The implementation subgroups for all ages, all stages have begun meeting as of June 2025. We've had several meetings. Each group is focused on early action aligned with the plan. If you did not receive an invite in the first wave, there's still time to join us. We'll be sending out the next round of engagement opportunities in October in advance of our next quarterly meetings. We want these meetings to grow, evolve with the right mix of voices, especially as they start to build momentum and shared ownership. So now we're going to hear from our subgroup leads on what they've done with the subgroup areas, the first year recommendations, first meeting takeaways, emerging priorities, and plan direction and next steps. So there are 3 all ages, all stages North Carolina implementation subgroups: housing, connectivity and digital equity, social determinants of health and our age-friendly work. And then we are also going to be integrating APS as an external subgroup once the DSS audit adult services APS design team reconvenes their work. So now we're going to hear from our subgroup leaders. So take it away, Carissa and Deetra.
Thank you so much. Yeah, I think Deetra's on here as well. We're co-chairing this fantastic group today. Well, for the next 2 years, which is really exciting, this implementation phase. After working to write it, it's really incredible to now get started on the work. One of the things that we've been focused on here initially is obviously the wider goal is increasing access and shoring up the existing, especially affordable housing that we have, but we've been focusing on universal design and encouraging development and adaptation of housing so that it's more accessible to really anybody of any ability or any age. And that's the really core of what we've been doing for our last couple of meetings, including getting some presentations from folks that are experts. And I'll let Deetra chime in here too. I don't want to take up all the time.
I think you covered it pretty well. Yes, we met twice. Both meetings were successful. We rely heavily on our sticky note assignment to make sure we are staying on track. And I was very excited, and I'm sure the group was very excited to hear from Richard on the universal design and just how this could really impact and change the game in the permanent supportive housing world. I know, especially for people that already have disabilities or people who are aging, being able to age in place without having to come out of pocket or find assistance for modifications is it's exciting to think about in the future. So I really don't have anything else to add. I'm excited to be a part of the group and working along with everyone. And Carissa, we do a pretty good job of piggybacking off of each other so far.
Yeah.
So
great pairing.
Yeah, we've added a new member, Josh Walker, who is the Olmsted Director in the Office of the Secretary, and he has a lot of knowledge about housing and the Olmsted Settlement Agreement and our need to comply with that, and how this integration of the work here and some of what we're doing on the North Carolina Strategic Housing Plan can really push forward our efforts to expand housing stock for people who are aging and people who are disabled. So I'm excited about that.
Yeah, and further to what Deetra mentioned about a little bit of recruitment, while we have what I consider to be an exceptionally well-rounded group, one piece of the puzzle I thought we could use was some perspective from folks that do some development, particularly senior focused development, but also who currently voluntarily use a significant amount of universal design in their properties that they develop. So they've joined us as well. So I think that's the best part about this group is that there really is an exceptionally well-rounded perspective base among the people that are participating. So I think we're taking pretty practical steps.
It's a great group, guys.
Yeah.
Okay, Louise and Turkesia.
Hello, everyone. Turkisha's not with us today. I don't think she's transitioned into another role, so you'll just have to put up with me. It's great to see all of you. In terms of our focus and goals, we want to strengthen our efforts to raise awareness about social support resources and programs, and also want to strengthen our collaboration between public, private, and nonprofit organizations that serve older adults, ultimately with the goal of reducing their social isolation and increasing their engagement in their communities. Our second goal is to improve technology access for older adults, especially in underserved and rural areas. And we hope to do that through training, broadband expansion, and other kind of physical resources. And we also hope to increase the sustainability of North Carolina's kind of statewide digital efforts more broadly. And in terms of our subgroups representation, I think we've got a great diverse group of folks. We have two institutes of higher education in North Carolina, in the North Carolina University system, and Campbell University. Two staff members from area agencies on aging, two North Carolina Senior Tar Heel Legislature delegates, someone from AARP, 5 nonprofits, and one public DHHS division other than the Division of Aging, where I am, which is focused on accessibility and sensory loss. So in terms of our meetings, we've only had one meeting so far. We met on June 20th, and our next one is scheduled for Friday. And mostly we focused on getting to know each other and kind of grounding all the members in the multi-sector plan and kind of the current landscape as it relates to our subgroups recommendations. And we
Louise,
also,
I'm
yeah.
going to pause for a second. We're having issues with the interpreter pinning right now. So we're
Oh,
going to
no,
pause so we
okay.
don't miss anything.
Sure.
So we might have to get you to back up a little bit as well when we
Sure.
get back in. So we're trying to figure out our pinning. So I see that Joseph, which Michael, he's on my screen now, and I'm adding a spotlight for everyone. So let me know in the chat if that works. And Carlene, her screen is still black. So I don't know. Okay, worked. Okay. We got thumbs up. All right. Okay. I think we're good, Louise. If you want to,
How far back should I go?
I'm not sure when it went out. So I
I think we
see.
just start from the beginning, if that's okay. Just to
Sure.
recap. everything.
Sure. Okay. So you'll have to put up with me a little longer.
Thanks everybody
Okay.
thanks for flagging that for us, everybody.
So you are able to see Carlene now?
All set. Okay, great. Hello, everyone. It's great to be with you. So first of all, just looking at our subgroups, focus areas, and goals. We want to strengthen our efforts to raise awareness about social support resources and programs. And we also want to strengthen the collaboration between public, private, and nonprofit organizations that serve older adults, ultimately with the goal of reducing social isolation and increasing their engagement in their communities. Our second goal is to improve technology access for older adults, especially in underserved and rural areas. We hope we will do that through training, broadband expansion, and physical resources. And we also hope to kind of increase the sustainability of North Carolina's statewide digital efforts more broadly through this work. In terms of the representation of our subgroup, we have great kind of diversity with the sectors and roles that are represented. There are 2 area agencies on aging represented, 2 institutes of higher education, Campbell University, and then one of the UNC system universities, 5 nonprofits and community-based organizations, 1 person from AARP, 2 North Carolina Senior Tar Heel Legislature delegates. And then we also have another, in addition to the Division of Aging where I am, we have one other public DHHS division, which is accessibility and sensory loss. So unlike the housing group, we've only met once, but our next meeting is scheduled for Friday. And mostly we just focused on, introductions, getting to know each other, grounding all the members in the multi-sector plan itself and the current landscape as it relates to our subgroups recommendations. And we also looked at some potential entry points for change. And in terms of the themes or priorities that emerged during our first meeting, we want to advance social connection and long-term digital sustainability statewide through storytelling. And so we plan to determine like which stories should be told and who should tell them. And we also want to increase public awareness of the digital sustainability plans and the current initiatives, some of the work that's already being done through Social Bridging NC and through North Carolina's DIT Resource Finder. We also will leverage existing digital equity programs and try to avoid duplication. And next steps, we're gathering input on storytelling ideas via a shared kind of brainstorming document. On Friday, we will have a representative from NCDIT will present on existing digital equity program analyses. And we also will build member awareness of Social Bridging NC, the website and the resources that are there. And we will continue to explore practical, low-cost actions and in-kind resources. And that's it. Thank you.
Great. Thank you, Louise. And to our final group, who have just finished a meeting right before this webinar started, Rebecca and Barbara.
Thank you. Thank you. And welcome to you all. And I'm also excited to be a part of this group. And I think Barbara's on here somewhere. So hopefully I'll speak first and then pass it on to Barbara. But it's also, with Barbara and I just working on our subgroup, it's very nice to hear updates from the other subgroups. So thank y'all for hosting this and allowing this time because it is nice to hear what the other groups are doing. So for our year one subgroup focus is, of course, as you can see, prioritize transportation and nutrition to improve health and independence for older adults, addressing barriers through an environmental scan. So as was just said, we just had our second subgroup meeting right before this meeting, and we've decided to begin our process of obtaining information on our topic by conducting 2 environmental scans. So we're going to do a scan regarding transportation and nutrition as they relate to addressing barriers for older adults in obtaining improved health and independence. And so what we've done is we've created Microsoft forms. We also have a spreadsheet, and what we've tasked our subgroup with doing, giving them homework assignments each time, is to reach out between now and our August meeting and to reach out to at least 20 within their area, within their county, within their region, organizations or agencies, and just contact them. And we're going to use these scans to assess the conditions of both barriers and innovative ideas regarding access to transportation and nutrition for older adults across North Carolina. So we're going to do that this first year, and hopefully just gather the information at the August 20th meeting, kind of do a check-in and see where gaps are and where we need to address more information. And I'm going to pass it off to Barbara.
Okay, thank you, Rebecca. And you've done a great job of setting the stage for what we're about. My role, because I'm such a linear person, that I have actually put together a timeline chart that we shared with the members today. And one of the important things of the second meeting was still getting to know each other. So we have a membership form that's being completed by the members of the subgroup. And once we have, I guess, I'm looking at maybe 90% of the data in, Divya and Kaylee will be working with us to produce what's called a who and where map for the state of North Carolina, so that we can get a better understanding of who's who and where they are. Because when we do our environmental scans, we want to not have more crossover than is needed. We want to look at how we can group ourselves either by COGS or the area agencies on aging and work together that way. We also talked about having a disclaimer put on the cover letters perhaps, or the introductory email, to say to our people that perhaps you may get contacted more than once by a different person, because we realize the overlap that is there. But you only have to answer the information one time. We had a lot of good interaction among our members, making suggestions as to how best to deliver these requests to the agencies and organizations. And I think I mentioned we talked about disclaimers, because that's an important thing, because people like to make sure that what they're saying and what they're reporting out to us is valuable. So that's a good point. I put together a timeline, as I said, that goes through the 12 months, the 1 year that we're supposed to be working together, with breaks that show each month. We look at where we are. We look at the good, what did work and what didn't work, and try to use that to prepare for getting our information from the next month or the next session. As I said, we talked about the overlap, so that was good. And we talked about how to best communicate with each other. We have the SharePoint database, which is where all of our forms and templates and spreadsheets and everything are located. And that way each member can log in from time to time and look at what's going on, make comment, hopefully ask questions. And Divya said something about, and perhaps Kaylee, about how we could set up our SharePoint site so that questions can be answered. The answers can be seen by everybody. And what we're trying to do more than anything else is to make this a collective, to make sure that everybody understands that everything you bring to the table is appreciated. And we just look forward to working with our group and getting to know them better. Thank you.
Thank you, guys.
Thank you, Deidre, Carissa, Rebecca, Barbara, Louise, and Terticia. You all have done a phenomenal job thus far, and we really appreciate all the work that you are doing. You're making Janice and my work a lot easier just by the talent that you bring to the table. So we really, truly appreciate you all meeting with our groups. Our subgroups are active, everyone on the call. We have a very active set of subgroup members who attend. You know, I'm just amazed each time we have a meeting. So thank you, thank you. I feel like we're going to reach our goals. So now I am so honored to introduce our speaker for today, Dr. Leanne Clark-Shirley. We are thrilled to begin this next chapter of All Ages, All Stages, NC with a national voice who brings both deep expertise as well as a bold vision to the table. And the other best thing about Dr. Shirley is that she lives in my city, and I'm really happy about that, the city of Durham. Dr. Leanne Clark-Shirley is the president and CEO of the American Society on Aging and a nationally recognized leader in the field of gerontology. With nearly 2 decades of expertise spanning nonprofit leadership, policy research, and strategic evaluation, she brings a unique cross-sector lens to the aging field, one that bridges practices, policy, and impact. Before joining ASA, Dr. Clark-Shirley served as a senior evaluation advisor at AARP, where she led enterprise-wide strategic planning and built systems to track real-world impact. She previously led the Aging and Disability Research practice at Impact International and has long been a mentor for emerging leaders in aging. She is a fellow of the Gerontological Society of America and holds a PhD in gerontology from the University of Maryland, Baltimore County. Next slide, we invite Dr. Clark-Shirley to help us kick off implementation, because she understands not only where the aging field is going, but also what it takes to get there. Her leadership at ASA has sparked a national conversation about how we think about aging as a shared societal responsibility. And in today's presentation, as you can see on the slide that's on the screen at the moment, Leanne will spotlight national strategies and emerging practices that are helping communities across the country become more inclusive, age integrated, and resilient. And her remarks will highlight how age-friendly principles, especially in housing, which you've heard some of the housing initiatives, transportation and social connection, you've heard some of those, can be woven into broader community development and infrastructure efforts. She will also speak to how local and state work, like All Ages, All Stages, North Carolina, can align with national frameworks to drive measurable, lasting impact. Along the way, she will evaluate best practices from other states and communities, offering both inspiration and actionable ideas for our work ahead. The key word there is actionable ideas for our work ahead. Please, please, please join me in welcoming Dr. Leon Clark Shirley.
Thank you so much, Daryl. Hi, everyone. It's great to be here with you. Can you hear me okay? Excellent.
Yes.
So I'm going to use just a couple of slides and approach this more just from some reflections on the current moment in which you are implementing this very important multi-sector plan, share with you some insights as fresh as yesterday. I'm back. I got back around 11 p.m. last night from a trip to DC. I was at a convening celebrating the 90th anniversary of Social Security. So the landscape is moving quickly, and my thoughts are changing almost daily. And Barbara, I just have to say, you said that you are a linear person. I strive to be like you when I grow up. I am a circular person. So so you'll see some of that in what I have to share with you today. So my goal is tell you a little bit about ASA, tell you a little bit about where I see things going at the federal level, talk about some opportunity areas, and the spoiler alert there is it's all about partnerships. And then close with some thoughts on, ways forward, like Daryl said. What can we do now to get us where we need to go? And I want to just start by saying I do not have all the answers. Unfortunately, no one has all the answers right now. But fortunately for North Carolina, you and the collective work of this group will absolutely be writing some of the new future for the state. I wanted to, before I tell you about ASA, I do some teaching when I can. I love teaching undergraduates. And I always start by asking them a question, and I want to ask you too. It actually comes from a quote from baseball player Satchel Paige. Perhaps some of you know this already. Satchel Paige asked, "How old would you be if you didn't know how old you were?" So I just invite you to sort of sit with that question and feel free to share your thoughts in the chat if you'd like to. How old would you be if you didn't know how big you are? Or how old you are? Sorry, I was reading the yes. Anyone have any thoughts? How old would you be if you didn't know how old you were? $30. Depends on the day. Yeah. 40. Yeah, as you think about that, 29 and holding, I like it. As you think about the answer to that question, just, think about what's behind your answer. Think about what's informing your answer, and think about the power that we all give to the number of candles on our birthday cake. Think about why we do that. And as you implement this wonderful plan, I love the name, All Stages, All Ages. That's what it's about. But I think we owe it to ourselves and to each other to really think about why we give so much credence to how old we are, why we start programs at the age of 65 or 50. What does it really mean? 19 until I try to get off the floor, Bethany Wagner says. Yes, sometimes our knees deteriorate faster than other parts of us. Well, thank you for humoring me. So like Daryl said, I'm Leanne Clark Shirley. I'm a gerontologist by training, and I've been working in this field forever. And I have the real honor of leading the American Society on Aging. If you don't know ASA, we are a 71-year-old membership association, the largest multidisciplinary membership association focused on aging. And we're a professional home for everyone who works with and on behalf of older people. Everyone. It doesn't matter what industry or sector you're from, you're welcome at ASA if you care about an age-inclusive world. The members of ASA include major aging network and advocacy organizations like the National Council on Aging, like US Aging, home care organizations, tech companies, startups, nonprofits that are opening up community-based computer labs for people of all ages, for instance. We have HR professionals that are members. We even have some graphic designers and some companies that are selling products and want to understand how to design and market those products more effectively. So we really, I like to say it's our greatest strength and our greatest challenge to be truly multidisciplinary. How can we represent the interests, the opportunities, the challenges across so many sectors, across the public sector, the private sector, nonprofit? How can we do that? I think you and your multi-sector plan on aging face the same strength and challenge. You are writing something that applies to every single person in North Carolina and that applies to every single sector operating in the state. So I don't have a concrete answer to how you do that, but I encourage you to lean in and keep pushing towards finding new ways to integrate sectors you may not have thought have any relevance at all to this, because I'm telling you, with our aging society, they do. So when we were prepping for this call, Daryl, I think it was you, she said, "Hey, are you going to bring us some good news from DC?" And I said, I do not think so. I'm very sorry, but I do not think so. And, you know, having landed back at RDU yesterday from being there, my answer is still the same. I don't have good news. I don't have bad news. What I have are some observations that I'd like to share with you all. People ask me all the time, where are things going? Where are we heading? And what I can say with certainty is that the uncertainty continues. Things are moving so rapid at the federal level in the public sector. But there are a couple things that are true. There are a couple objective facts that I think we should all hold on to and use to ground ourselves, whether you're doing this work for the multi-sector plan, whether you're navigating uncertainty in your day jobs. The first observation is this: the demand and the need for the work that we do in service of older people and families it's going up, and it will only continue going up. Nothing that is happening in DC is changing the demand. Nothing that is happening is changing the need. In fact, it's getting greater. That's an opportunity. That is an opportunity for you, your knowledge, your experience, your organization to demonstrate real value. The second thing is, without a doubt, federal dollars are receding. That's happening in two different ways. And some of you know this much more acutely than anyone else. We've had flat funding for many federal programs and services to support people who are growing older and people with disabilities. Flat funding during a time of increasing demand and need means decrease in funding. When you have the same pot of dollars, but more people that need them, fewer dollars are available to each person that needs them. And then, of course, there are also cuts happening. We have seen cuts to Medicaid and the big beautiful bill that will not kick in yet. We've seen cuts to SNAP that may kick in a little bit quicker. And to be honest with you, we're not yet sure exactly what cuts will be coming down the pipeline, how they'll affect North Carolina, but that is under negotiation right now in DC. So this is a really good time to call your elected officials and express your support for continued increased funding for things like the Older Americans Act. Invite folks in to your agency. Invite Phyllis to one of your meetings and talk to him about the importance of the work that this group is doing. This is the time to be doing that. The third observation I have is that there's very real institutional knowledge under threat. Our federal agencies have operated for a long time with a relatively large workforce of people that understand our programs and services like Social Security, like Medicare. They understand those inside and out. As reductions in force happen in our federal agencies, there's a lot of institutional knowledge that they have that will continue going away. It's not gone, it's under threat. There are still people there keeping these programs running, but it's under threat. Work is continuing. For those of you that follow the organizational changes happening specifically within the Administration for Community Living, which is the agency that essentially operates the Older Americans Act and services for people with disabilities. That agency has been parsed, has been separated into pieces. Some will go into the Centers for Medicare. Some will go into a new agency called the Administration for Children, Families, and Communities. However, as recently as yesterday, the Administration for Community Living is showing signs of life. They are issuing grant opportunities. They're issuing contract opportunities to keep their work going. But I would be remiss if I didn't acknowledge that I think 1,500 more ACL staffers were let go on Monday evening. So it's uncertain. There's signs, there's folks that want to continue the momentum, but we just don't know how it's all going to pan out yet. And all of this affects, as the federal environment for aging services goes, so will states and localities, because demand is not going anywhere. The next thing I want to point out is the consolidation that we're seeing happening at the federal level. Like I said, ACL is part of this new Administration for Children, Families, and Communities. There's talk of the National Institutes of Health going from 27 distinct agencies into as few as 5 institutes. So again, uncertain what this will look like, but without a doubt, there is consolidation happening. And I actually see some opportunity in that I'll talk about in a second. But before I get there, I wanted to share my final observation, final fact that we can hang on to. Public awareness is going up about the need and the importance and the value of investing in our aging society. That's going up. The relevancy that everyday Americans see and feel to aging services and programs, it's creeping up. There's more people than ever before aware of and talking about these issues. And advocacy has been pretty darn strong. That's going up too, meaning when people understand what's at stake, they're willing to share what they want and need with the elected officials that are negotiating it all. Increased need, federal dollars receding, institutional knowledge being threatened, consolidation, but public awareness going up. That's the situation that we're in. So as we're navigating all of these uncertainties, as you're thinking, how can I implement this plan? Those are just some grounds of truth to hang on to as you're charting your way forward. So now I want to turn to some opportunity areas that I see as that existed before, that exist now because of, and that may exist in the future because of what's going on. And I want to say that, in my opinion, you know, in this time of consolidation, in this time of figuring out how we can use technology to operate more efficiently and more effectively, there is a real opening for us here to demand, insist, lead by example, whatever you want to say, demand that we infuse aging into every single agency, every single public program, every single private sector. Doesn't matter. The demand is going up. Everyone working and living in North Carolina, everyone working and living in the United States, aging is relevant to them. And we have a real opportunity moment here to state that case, make that case, and offer our knowledge, our networks, our connections in support to help people figure out what they're going to need to do to meet the moment that our demographics are bringing us. I think most of you know this. Every day, 11,000 Americans are turning 65. There's 7 states, I think, right now that have more people over 60 than children under 18. There were only 3 states 4 years ago. It's happening real fast. People are going to be looking for folks that know how to handle this. You all know how to handle this. How can you position your knowledge, your organizations to be part of the solution? That's a real big opportunity, I think. I think, you know, North Carolina was prescient in starting the work of the multi-sector plan when you did, because states that haven't started it yet are going to be in a deficit to meet the moment that we're in. So I just want to applaud the work of this committee and tell you to keep going. The only way forward is through cross-sector partnerships. I really believe that. I really believe that. And the work you are doing to figure out what that looks like is instrumental. I'm just reading the chat comment. Churches, the faith communities. There's a comment in the chat about faith communities, gospel radio, social media. I'm with you. Yes, we have to figure out a way to invite the entire community to the table as we talk about the ways forward. So I hinted at the beginning, you know, the path forward and the real opportunity areas, the areas for innovation, whether you're talking about social isolation, housing, mental health, it's partnerships. Janice, you might have said this at the top. No one agency can do this alone, nor should they. That's absurd. Partnerships are going to be transformational. The first partnership opportunity that I see is getting closer than you've ever been before with the disability community, disability networks, disability justice movements. They are, despite best efforts, despite best intentions, there's been a little bit of a separation in the aging and the disability world. There's been a lot of effort to bring them closer, and we are inching closer together, but there's still a real need and a real opportunity right now to make those worlds work better. Why? Why the disability community that you haven't already pulled in? Well, there's very strong networks. There's very committed people that are passionate about their needs and wants, very aligned on their mission to creating a world where all of us can live good, long, happy lives. Many of us will acquire a disability over time. Many people with disabilities are living longer than they ever have before and will need what the Aging Network provides. And the disability world and the aging world, we share so many of the same challenges, like access to good, acceptable, comfortable housing, workforce shortages. Both sectors are dealing with workforce shortages. Both sectors serve people that face enormous discrimination. We all have funding challenges. And we all have an opportunity right now, I think, to position ourselves as valuable partners for every sector that wants to meet the moment of our aging society. And like I said before, we share the same aspirations. We want good, long lives on our own terms. So now feels like a moment, more than ever, where we can partner up aging and disability. And I'll give you some examples of partnerships in a moment here. The second partnership opportunity area that I feel is really important is public-private partnerships. I think as public dollars recede and as need and demand goes up, I think the private sector will step in some way to help fill gaps, provide services, support needs. They're going to do it with profit on their mind. But if they're going to do it, all of us might as well be at the table to help them do it right. When I think about a successful multi-sector plan, it's got to include easy, value-based runways for the private sector to join in and partner. It's got to. And I will say it's the biggest challenge that every multi-sector plan is facing. Getting that value proposition right to appeal to the private sector takes time. If you work in the nonprofit sector, you're not used to talking about your organization in that frame, in that language. You're not used to thinking about quote unquote making money. But we have to start inviting the private sector to the table in ways that bring value to them and in ways that help us fulfill our missions too. The third area is tech. ASA has been doing a lot of work to help the tech sector design better solutions to meet the incredible diversity of our aging population. And I think when it comes to multi-sector plans too, and again, if you focus on topics like social isolation, so many tech companies want to get in there and fix that problem, and they think they have the solution. They're like, I'm gonna create an innovative solution where I'm gonna put an older person on a live chat, a Zoom call with a younger person. I've seen that solution 89 times probably, and they're great. Yes, do it. But the way to get this right is to not build yet another solution. The way to get this right is for you all to come in and say, hey, we are trying to tackle social isolation. We're trying to tackle loneliness. Here is how we understand the problem. Here's what we know about the problem. Here's who faces the problem. Here's how age comes into it. Here's how gender comes into it. Here's how neighborhood comes into it. Whatever. You all know this because you work every day with older people. Bring what you know to the tech sector and co-design so that they can get it right in service of their goals and in service of your larger mission. The fourth area is looking for unexpected partners that are mission aligned and what I call age agnostic. I love to walk into a room full of age tech startups and go, who do you design for? And so many say like, oh, the 65 plus. But okay, what if chronological age didn't exist? Who do you design for? And some of them can answer that question. Some of them cannot. And that just goes to show you how many assumptions we bake into chronological age. And I think that can get in the way when we think about new partnerships too. So I'll give you an example of a company in a moment, but what other initiatives are going on in North Carolina right now that aren't even talking about aging, but that are trying to address social isolation in rural neighborhoods? Who is doing work with a similar mission to each one of the work groups that this effort, each of each of your work groups has a mission, has a purpose, has an objective. Think expansively, agnostic of age, about others that are doing similar work. Maybe a health system is doing something around food as medicine. Maybe they're not talking about older people. Maybe they should be. Maybe you're the one that can give them the information they need to embed aging into their work. So I'm going to show a few slides now to give you some concrete examples of what these partnerships could look like. And then I'll conclude with a few thoughts on housing and then open it up to questions. Does that sound okay? Is everybody still with me? Okay. I'm going to attempt to share my screen. That's not working. Hang on. It's me, not you, I promise. Okay. Window. Okay. Daryl, can you see the slide I have? Okay.
Yes.
Okay. All right. All right. So the first slide shows the heading is Colorado Department of Human Services Partnership, supporting Coloradans with intellectual and developmental disabilities across the lifespan. There's an image of two older appearing adults kayaking on a beautiful Colorado River. Colorado really loves to get into their natural beauty in the images to show that the work that they do. And that was taken from their multi-sector plan on aging, which was just released just a couple weeks ago, I think. So this partnership, the goal of this partnership is to, and this is an example of partnering with the disability community. The goal of this partnership is to develop a blueprint that supports adults with intellectual and developmental disabilities across the lifespan. Why? Because Colorado identified two pain points. There was a historical lack of evidence-based care practices for the IDDD communities. But as people are living longer and living in communities, Colorado saw an opportunity to prioritize their social and emotional well-being as they aged into older adulthood. And the second pain point that they identified was that many people with IDDD are outliving their caregivers and are in need of services. So they are partnering up, led by the Department of Human Services. They're partnering with the Disability Opportunity Office, the Colorado Neurodiversity Chamber of Commerce, the local ARC chapters, those are disability advocacy groups, if you don't know them, the Colorado Department of Healthcare Policy and Financing, and other potential partners to jointly work together as a coalition to design a blueprint. So I wanted to point this out to you in case it inspires some additional folks that you can bring to the table from North Carolina, from the disability community, all towards solving a shared problem or realizing a shared aspiration. The second example I have is an example of a health plan partnership. Vitalic Health is a new startup that I recently became familiar with that I'm really impressed by. And there's an image on the slide showing Vitalic's tagline, behavioral health specialized for aging adults. And there's a woman sitting in a grassy green yard outside, looking content and happy, demonstrating that older people are still worthy of having good emotional and mental health outcomes. The goal of Vitalic Health's partnership, and this is largely a tech venture, is to provide effective behavioral health services and geriatric psychiatry care to older people through their health plans. Why are they doing this? Older people face mental and behavioral health issues, but experience higher rates of misdiagnosis, underdiagnosis, mistreatment, undertreatment, lack of access, stigma. Yet, studies show time and time again, when older folks with such issues have access to treatment, their outcomes are better than younger populations sometimes. So Vitalik Health recognized the partnership opportunity here and said, hey, we have a tech platform, we have mental health expertise. Let's find health systems and plans to work with who don't currently offer such services to their beneficiaries, and many of them do not. And let's partner up to solve this problem together. I bring this to your attention because it may inspire new directions for you to go with some of the health systems here in North Carolina. Duke has a tremendous aging research collaborative, for instance. If they're not part of this effort, they could and should be. But even beyond that, as hospitals here in North Carolina deal with the fallout of cuts of Medicaid in the years forward, they are going to need your help figuring out how to keep people in the community healthier before they even get to the hospital. Otherwise, their costs will grow. There's going to be a real need for what you have to offer here. And I really love the model that Vitalik is using to solve a problem through a somewhat straightforward, but unfortunately still innovative partnership. Third example is a tech partnership. And it's from a company that has an office in your fair city, Daryl, right here in Durham. They're a venture called ThoughtBot. And on this slide is a screenshot from ThoughtBot's website, and their tagline is, "Let's make your product and team a success." What's important to know is ThoughtBot knows nothing about aging. They care about, their goal is helping other tech ventures design better products and better solutions for all markets, including age markets. ThoughtBot is not a subject matter expertise in aging. They don't work, the clients that they serve, the startups that they serve, they don't know about aging either, but they know they want to. They know they need to. Too often, tech startups design solutions with one person in mind or without the full picture of the diversity that is inherent in aging in mind. And so ThoughtBot knows that it's important to understand the ecosystems in which we're all aging, who we interact with, where we live, what our house looks like, what the air is like around us. Do we live in a floodplain or not? That's increasingly important. All of this matters to how we age. All of this matters to how we navigate our needs and our wants. Tech sectors need to understand this context so that they can design the best solutions for it, rather than just building one more solution to cure social isolation. So ThoughtBot is partnering with their startup clients, but also after coming to our conference this fall, they're engaging ASA members in sort of an expert sharing mode. They know that ASA members, including some of you on here, you all understand the ecosystems in which people are aging. You are part of those ecosystems. You have something to offer ThoughtBot and its startup clients so that they can design better tech. And finally, there's just so much promise in continuing to grow nonprofit partnerships that are mission aligned but age agnostic. Given Hour is another local company. They're based in Chapel Hill. Given Hour is a nonprofit that connects at a national level underserved communities with free mental health and emotional well-being support. They know that groups that have higher risk of adverse mental health, like veterans, trauma survivors. They often face significant barriers accessing mental and emotional health. So they also know that there's thousands of providers and thousands of organizations across the country that are willing to step up. They just need a way to reach the people that need them, that can't access them. So Given Hour is pulling together nonprofits, providers, local, state, federal agencies, and any entity really that reaches into groups of older adults and families to work together to make sure access to mental and emotional support is available for all of us, no matter how old we are. They're not in the aging sector. They're not an aging services partner. They're a mental health nonprofit, but they are mission aligned with what you are doing, and they want to be more age inclusive. There's a million partnership opportunities like that out there. It's just a matter of getting rid of those assumptions we put around aging as a parameter for partnering. I'm going to stop sharing. And I know housing is an important issue for everyone. Am I good on time, or do we need to stop?
Divya, I think we're good.
Yeah, we're good.
Okay.
We're good.
This won't take very long. It's an observation that that I made just yesterday when I was at the Social Security event. So I've talked at you quite a bit about the context, the uncertainty. The way forward is partnerships. It has to be. But housing is a really tough issue to solve, even with the best of partnerships, especially when funding is receding. And I don't have an answer for you, but what I wanted to share is that while we are in this year of celebrating the 90th anniversary of Medicare, of Medicaid, of Social Security, all of that, of course, came from the Social Security Act that was signed into law 90 years ago. And it was part of the New Deal. And the New Deal was FDR's signature response to the Great Depression. Mm-hmm. It focused on a very clear, very bold, very aspirational objective. That objective is relief for the unemployed, relief for the poor, recovery for the economy, and reforms to prevent a future depression. That's what was going on during the time that the New Deal came up. It was the shared American pain, struggle, need, and aspiration for better lives that created the environment and the political capital for the New Deal to arise. And I've been thinking about that in context of where we are right now. And need is going up, public support is going down. There's a lot of uncertainty. There's a lot of fear about what's happening. I actually think the housing crisis that we're having could be positioned as a unifying problem to solve through a clear, bold, aspirational objective. So many people are feeling this pain. So many people will continue to feel it as our society continues to grow older. And when I think about the multi-sector plan on aging and how housing is a part of it, I think the messaging has to be bigger than advocating for access to housing as we grow older. The messaging has to be bold, aspirational. All of us deserve good, comfortable places to live, and not all of us have that yet. What can we do together to fix it? Again, it's not a solution, just an observation, but I wanted to end on that note, and now I will stop talking at you and hopefully talk with you.
So, Leanne, we certainly appreciate the information you've given to us today. And I kind of thought about you were putting us on a spectrum, kind of, where you can make changes along the way. But I think often we feel defeated because so many things, are happening that are just not right. But you put us on that spectrum and took us to opportunity. And I think that's the direction and the place where we need to be. And I feel like all of our work groups are there. They're looking at everything as an opportunity. And I think we just have to stay there. As hard as it gets, we have to stay there because there's some light at the tunnel here. or in the tunnel, wherever the tunnel is, that, you know, we can really make a difference and transform our community in a way that all ages, all stages has set. So we truly appreciate your insights today, the perspective you've given us, the examples you've given us, and, you know, we're going to take that to heart. And yes, housing is moving in some of those directions with disabilities and all of that already. So I think that just pumped a little energy into that group as well. And so Divya is going to handle the questions, but Janice, do you have any additional comments for Leanne?
I'm just inspired. I'm sitting over here. I've got a page full of notes, and I am just so inspired by you that, yeah, there's just so many opportunities for us, and the Given Hour, the couple things that you mentioned that are right here with us, Given Hour, I thought, oh, I needed those folks yesterday because we had the flooding here in Chapel Hill. We were gathering our troops of like how the behavioral health resources we have, which obviously we don't have enough. So I need to talk to those people. The Thought Bot, you know, I've been in contact with someone with AI. And so, and then again, the thing to inspire us for us to all tell our story. And we've been talking about that. It's so key for each and every one of us on this call to tell our story of the impact of our work. So that's where I'm at right now. So thank you, Leanne. It was great. Great.
Thank you so much. Thank you. And I should say, Kaylee and Divya, however you all want to handle the questions, I'm just grateful that Leanne was available today and was able to bring this to us. So, and I'm glad we're recording it too, so we can go back. Looks like
oh
we
yes,
may
I
have
want to
some
share.
questions.
I want to get my staff to hear this. So yeah, it's definitely going to be shared.
I thought I saw a hand. Divya, Kaylee, do you all want to just take over? It looks like Mary Bethel has some comments.
Yeah, it'd be great to turn it over to Mary.
Yeah. Mary, unmute, Mary.
There we go. I had a question. Great presentation. Thank you so much for being with us today. I think we all needed that little pep talk as and talk about opportunities. So I'm interested from the national perspective. I know everybody's been busy putting out fires and addressing all the uncertainty that's going on. Do you see any coming together with national organizations and groups trying to coalesce around one or two top issues that we can coalesce around at states also at this point?
Your question is much more timely than you realize. Yes, the moment we are in now seems to be, you know, the fight for Medicaid protections was hard fought. How it was won is up to all of our interpretations, depending on where we stand. But preserving and shoring up funding for the Older Americans Act, the time is now to start talking about that and advocating that. You will start seeing some national level messaging coming out around that soon. And I know that's cryptic, but it's literally in the works, in the planning stage right now. But without a question, advocating for increased funding of the Older Americans Act, the time is now.
Thank you, Leanne, and thank you, Mary. I think we had a couple more questions. Someone else had their hand up, but we'd like to open it up to the broader public to ask questions for Dr. Leanne or any of the subgroup leads about the work groups and the direction that they're taking for year one. So I can't see who has their hand up, but
it's AC, whoever that is.
Yeah.
AC, go ahead. Yeah.
Yeah. Can you hear me?
Yes.
Okay, great. Just a small question, maybe a direction. Right now, I'm a student at the University of North Carolina, Chapel Hill, and I'm working on making a student organization that is focusing on healthy aging. I want to have a way for my group to involve in the project that is going on right now in North Carolina. I don't know if you can maybe give me some hints of where we can start, how we can help. Right now, we're focusing on outreach groups and we're trying to make an impact on older people students. But I'm in the starting process, so maybe I just had a question to see if you have something where we can start.
Is your question about how you can get involved with the North Carolina multi-sector plan?
Yes.
Okay. Then Daryl, that's all you.
Yeah, that's Divya. She just took off her, her mic.
Yes, we would love to we'd love to set up a conversation with you to learn about which subgroup you'd be most interested in. I think I heard you say you were interested in creating a center for healthy aging. And so with that, we actually do have a health and well-being subgroup under our Optimizing Health and Well-being work group. They'll actually be presenting next week if you're interested in learning more about their group's priorities, and then we can introduce you to their subgroup leaders and their next meeting.
Great, thank you.
And Romero, if you're here in Chapel Hill, I'd be happy to talk with you.
Sure. So who's that?
My office is at the Seymour Center.
Got it. Yeah, that would be great. Yeah, maybe we can send me your email.
Thank you.
That would
Any
be
other
great.
questions?
I can't see any other hands. I don't see any other hands.
Well, thank you so much, Dr. Leanne. This was such a really needed conversation, and all the perspectives you shared are going to be really valuable as we move our plan forward. And so I'm going to wrap up our presentation with some brief closing remarks. Our director is not able to join us, but she will be joining the rest of the webinars next week. And so a couple things that we want you to take away today is, you know, as Janice and Daryl stated, aging is a lifelong process. It begins the day we're born, not the day we turn 20, 30, 60, 70. And so if we want North Carolina to be a place where people can age with dignity, choice, and connection, we really have to start now. And we're doing just that with the multi-sector plan for aging and strengthening the communities we all depend on. And so as Janice stated earlier, this means more than just the programs for older adults, but it means creating neighborhoods where everyone, whether they are 8 or 80, can get where they need to go, stay in their homes, stay connected, and stay supported. As Daryl stated earlier, we are already familiar with many of the barriers. We've continuously heard a lot of the barriers through our listening sessions and surveys. Lack of affordable and accessible housing comes up, limited transportation options, both in rural and urban areas, digital gaps that keep people isolated. And then one thing that's kind of cross-cutting is that the disjointed systems. But the good news is through the multi-sector plan for aging, we're not starting from scratch, along with our community of other states to leverage on. We have a strong North Carolina with local leaders, a lot of proven models, as you are seeing a lot of our subgroups are doing environmental scans to really elevate the great momentum and already all of the great work happening across our state. But what we really need is alignment, coordination, and a shared sense of purpose. And All Ages, All Stages NC gives us that shared framework. It connects the dot between healthcare, long-term services support, public health, housing, and so many other topics. So we're looking forward to working with you all across sectors and across systems, not just to serve people, but to support thriving communities. And as Dr. Leanne stated earlier, the work will not be done by just one agency. It's going to take all of us, state partners, local governments, community organizations, our advocates, our residents, working side by side. So thank you all so much for your expertise, your voice, and your actions. We're really looking forward to progressing this bold visionary plan together. And so I want to end by saying that this is a QR that'll take you to our All Ages, All Stages website. We would love to continue to have conversations. Kaylee put our email address in the chat earlier, so we would love to set up meetings with you all to learn more about where your current programs, services, or policies may align with one of the 8 priorities in our plan. We'd love to connect with your organizations to come share about All Ages, All Stages NC, and hear from you all too. We want to connect the success stories, the lessons, the stories and datas, as we're trying to build out our robust data dashboard across all of our 4 goals and 8 priorities. So we look forward to joining you all joining us next week. If you're able to, we'll be having a webinar on Wednesday as well as Thursday. Wednesday is going to be, our guest speaker is going to be focused on the direct care workforce. So you'll be hearing from Kezia Scales from PHI, Trish Farnham from the NC Center for Workforce for Health, as well as North Carolina is going to be launching our National Core Indicators State of the Workforce Survey. So our Advancing States partners and HSRI leaders will be joining us to share a little bit about how the first year in the pilot went for that survey. And then on Thursday, we have Bob Blancato sharing about ageism, financial security, and really connecting it to with policy and advocacy efforts. So thank you all so much.
Thank you, Divya. Thank you, Leanne, again. And thank you, Janice, everyone for attending today.
Thanks so much, guys. I hope you've been inspired and will join us on our journey.
Absolutely.
Thank you.
Thank you all for your leadership.
Thank you. You're quite welcome.
Thank you.
Thank you. Bye-bye.